Goldenseal is one of the top 5 selling herbal products in the United States. Native Americans historically used goldenseal for various health concerns, including skin disease, ulcer symptoms, and gonorrhea. Today's traditional use of goldenseal has broadened to include a natural treatment and prevention of colds, respiratory tract infections, allergies, eye infections, digestive issues, canker sores, vaginitis, urinary tract infections, and even cancer. Goldenseal contains berberine, which has been proven to be antimicrobial, anti-tumor, anti-inflammatory, and blood glucose lowering. It's also gained popularity after a rumor spread that taking the herb can help to block a positive test for illegal drugs. Goldenseal is also known as orange root, yellow root, or yellow pucon. It's a perennial herb belonging to the buttercup family. It's a low, sprawling plant native to the rich, shady soil of the deciduous forest of North America, growing from southern Quebec to northern Georgia and west to Missouri. Due to over-harvesting, it's now mostly commercially grown on farms in the US. Goldenseal plants have hairy stems with 5 to 7 jagged, lobed leaves and small white flowers that turn into raspberry-like red berries. The bitter-tasting roots of the plant are bright yellow or brown, twisted and wrinkled. The dried underground stems or the rhizomes and the roots of the plant are what's used to make teas, liquid extracts, tablets and capsules, as well as natural skincare products. Goldenseal's potent properties are primarily due to the alkaloid berberine, cannadine, and hydrastine. These phytochemical alkaloids produce a powerful astringent effect on the mucous membranes, reduce disease-causing inflammation, and have antiseptic effects. Goldenseal is an excellent digestive aid since it's very bitter and this stimulates the appetite, it aids digestion, and it encourages bile secretion. It contains berberine, which has been used in traditional Chinese medicine and Ayurvedic medicine for thousands of years to treat dysentery and infectious diarrhea. This is not surprising since berberine has shown antimicrobial activity against certain pathogens that cause bacterial diarrhea, including E. coli and cholera. And this was shown in a randomized controlled clinical trial back in 1987 involving 165 adults with acute diarrhea due to these 2 bacterial offenders. Goldenseal can be very helpful to people who are experiencing small intestinal bacterial overgrowth. Current conventional treatment for small intestinal bacterial overgrowth is limited to oral antibiotics, and there's inconsistent success. The objective of a study published in Global Advances in Health and Medicine was to determine the remission rate of small intestinal bacterial overgrowth using an antibiotic versus a herbal remedy. The researchers found that the herbal treatment, which included berberine, worked just as well as antibiotic treatment and was equally safe. Some people also use it for stomach swelling or gastritis, peptic ulcers, ulcerative colitis, diarrhea, constipation, hemorrhoids, and intestinal gas. Another impressive study found that among several herbs that were tested in vitro, goldenseal extract was the most active in inhibiting the growth of Helicobacter pylori, a type of bacteria which can lead to gastritis, ulcers, and even stomach cancer. Goldenseal is often found in herbal remedies for allergies, colds, and the flu because of its natural antibiotic and immune-boosting capabilities. Scientific research suggests that the medical plants like goldenseal and echinacea may enhance immune function by increasing antigen-specific antibody production. A product containing goldenseal and echinacea is an awesome natural bronchitis remedy. Additionally, research at the University of Texas Houston Medical School has shown that goldenseal's medicinal effectiveness as an immune stimulant may be due to its ability to reduce the pro-inflammatory response, which indirectly leads to limiting of the clinical symptoms during infection. There haven't been any clinical studies to date, but goldenseal is also sometimes recommended to treat urinary tract infections, which are caused by bacterial overgrowth in the bladder's interior walls. The berberine may actually prevent infection-causing bacteria from binding to the urinary tract. According to the Memorial Sloan Kettering Cancer Center, The berberine in Goldenseal has been found to induce cell cycle arrest and apoptosis, or programmed cell death, in cancer cells in multiple studies. For example, one in vitro study published in the journal Phytomedicine found that berberine inhibited the growth of breast cancer cells to a greater extent than doxorubicin, which is a chemotherapy drug. Berberine alkaloids have been shown during in vivo studies to have potent cancer cell killing activity against tumor cells. In vivo research has also been performed on a series of human malignant brain tumor cells and rat brain tumor cells, in which berberine was used alone or at a dose of 150 micrograms per milliliter, and it had an average cancer cell kill rate of 91%. In contrast, the chemotherapy drug had a cell kill rate of only 43%. The rats treated with berberine at 10 milligrams per kg had an 81% kill rate. Goldenseal has many other uses. It's sometimes used as a mouthwash for sore throats, gum complaints, and canker sores, which are small ulcers in the mouth. For any of these concerns, a Goldenseal mouth rinse can help reducing inflammation and getting rid of any nasty bacteria. You can purchase a mouthwash that already contains Goldenseal, or you can easily make some mouthwash at home. Simply get a cup of Goldenseal tea, let it cool before using it to rinse your mouth. Or you can add 5 drops of a liquid Goldenseal extract to 8 ounces of warm water with a teaspoon of salt and mix well. Goldenseal has been utilized as an eye wash for eye inflammation and eye infections like conjunctivitis or pink eye. The cardiovascular effects of berberine found in Goldenseal suggest its possible clinical usefulness in the treating of arrhythmias and heart failure. For this reason, Goldenseal is believed to possibly be helpful for chronic congestive heart failure and heart function in general. An animal model study published in the Journal of Lipid Research also demonstrates that the root extract is highly effective in the regulation of the liver's LDL or bad cholesterol receptors and in reducing plasma cholesterol. Overall, the finding identified Goldenseal as a natural LDL lowering agent. Goldenseal gets its name from the golden yellow scars that form on the base of the stem when it's broken. The scars resemble a golden wax letter seal, hence the name. It's been said that the powers of Goldenseal were first introduced to Europe's settlers by Native Americans, who harvested its rhizomes and its roots to treat a variety of health complaints, including eye, skin, and digestive issues. Native Americans also mixed the plant with bear grease for use as an insect repellent, and they used the color to dye clothing. Goldenseal has become one of the top-selling herbs in North America. It can be found as an active ingredient in many commercial or over-the-counter drugs in the form of elixirs, tablets, capsules, or suppositories. Health products combining it with echinacea are very common, and they're created with immune system enhancement in mind. Despite rumors, Goldenseal will not cause a false negative from a marijuana, cocaine, amphetamine, or other illegal drug test. The idea of using it to alter drug test results came from the novel Stringworm on the Pike by the pharmacist John Uri Lloyd. However, in this book, Goldenseal caused a false positive for strychnine, a poison, not illegal drugs, in a murder case. Goldenseal is considered safe for short-term use in adults at recommended doses. Rare side effects may include nausea and vomiting. Discontinue use if any negative reactions like these occur. It's not meant for long-term use. If you're currently taking any prescription or over-the-counter medication or have any health issues, check with your doctor before taking Goldenseal. People with high blood pressure, liver disease, or heart disease should consult their healthcare provider before taking it. Goldenseal is not recommended for use in children or infants. Pregnant or breastfeeding women should also avoid using it. Goldenseal can easily be found in tea or supplement form at a local health store or online. Depending on which product you purchase, make sure to read the label for each brand's individual instructions. For the powdered root and the rhizome, 4 to 6 grams per day in tablet or capsule form is sometimes recommended. For liquid herbal extracts, a typical recommended dose is 2 milliliters or 40 drops in 2 ounces of water or juice 3 to 5 times per day. Continuous use of this herbal remedy shouldn't exceed 3 weeks, with a break of at least 2 weeks between each use. You can also talk to your healthcare provider about what amount works best for you and your particular health concerns. It's best taken internally between meals. For external use, there's no standard recommended dose, but read the label of the topical products for instructions. Most likely, it'll recommend that you use the product on the area of concern at least once a day. Goldenseal is one of 5 top-selling herbal products in the US. The dried underground stem, or the rhizomes, and the roots of the plant are used to make teas, liquid extracts, tablets, and capsules, as well as natural skincare products. This herbal remedy inherently contains an active component called berberine, which research has shown can have numerous health benefits, including calming inflammation, boosting heart health, digestive and immune health, and even fighting cancer. Continuous use should not exceed 21 days or 3 weeks without a break of at least 2 weeks between each use.